The topic I will be exploring is how medication marketed to improve mental health is being oversold and borderline abused in North America. Major depression is defined by the 4th edition of the Diagnostic and Statistical Manual of Mental Disorders as a period of 2 weeks or longer where people are in a depressed mood, experience a loss of interest and pleasure, and may have problems with sleep, eating, energy, concentration, and have thoughts of suicide. 50% of Americans diagnosed with major depressive disorder take some form of antidepressants. There is a problem that this illness can sometimes be viewed as subjective, and as such, many people that do not meet the criteria of major depression get misdiagnosed with major depression. In an article from The Atlantic, it is stated that a study found that only 38.4% of people who have been diagnosed with major depression actually, by definition, have this disorder. If half the people who are diagnosed with depression take antidepressants and the majority of those people do not have depression at all, then there is a large portion of the American population that take antidepressants and do not significantly benefit from them. The subjectivity of depression is being used by the antidepressant companies to grow its already huge $11.6 billion USD industry. America is especially vulnerable since the US and New Zealand are the only countries to allow direct-to-consumer pharmaceutical advertising, also known as DTCPA, which is a form of advertisement where the pharmaceutical companies promote their medications directly to the patients. This means patients may demand certain medications that are either useless or even harmful from doctors. I myself have gotten many birth control advertisements online which all seem great until the end of the video where they mention how there is an increased risk of blood clots, infertility, and so on. The problem is that many people do not watch advertisements until the end and are left with a lasting impression of how easy it would be to get some birth control patches in their arm and not think about the many significant health risks they pose. As such, people who may be experiencing maybe a few blue days may be given antidepressant ads that do not show the whole picture of the effects of such medications. The misdiagnosis coupled with the DTPCA is why many Americans today are taking antidepressants unnecessarily. So what? Antidepressants have multitudes of bad side effects. There are physical side effects such as digestive problems, decrease in sexual desire and activity, and etc. Involuntary movements such as tics and muscle spasms, and even ironically, an increase in violent or self-destructive behavior. Many studies even suggest that antidepressants, when compared to placebos, double the risk of suicidal thinking in both adults and children. A few studies have even shown that antidepressants increase the risk of dementia by 30%, which is incredibly significant. Some people may decide to take antidepressants with good reason. However, with the misdiagnoses and advertisements, there is a heavy implication that the spike in the use of antidepressants in America may be harming people without the intended benefits. Another reason for the increase is due to many doctors prescribing antidepressants for other illnesses. This is troubling as researchers do not even understand how antidepressants alleviate some symptoms of depression, yet there are physicians prescribing antidepressants for a range of disorders including anxiety, insomnia, bulimia, attention deficit disorder, and migraines. While there have been some studies to suggest that antidepressants may help with these conditions, there's not enough evidence and the science is not solid enough to begin prescribing antidepressants to people who are not afflicted with depression. In conclusion, antidepressants have been shown to help people who have been correctly diagnosed with major depression. However, the antidepressant industry is taking advantage over healthy people through pharmaceutical to patient advertisements, as well as taking advantage of well-meaning health professionals. Overprescribing antidepressants is a problem because many healthy people will experience all of the negative side effects that can be very easily avoided. These are my resources. Thank you for listening.